Welcome to Academia. Today we want to consider leadership and management. Under leadership management, we are looking at supply chain management. Presenting is Mr. Malambo, the admin. Thank you so much for supporting Academia members. Please invite people so that they should also learn. God bless you. We are going to consider an MCZ question that relates to supply chain management. Question and this reads to say, as a new health center in charge, you discover that there has been a stock out of essential drugs and HIV testing kits for the past 3 months. You decide to give a presentation on supply chain management to the members of staff at your health center in order to improve the management of essential drugs and HIV testing kits at your center. The first question says, define supply chain management. Then 2 seconds says, list 4 commodities that constitute the supply chain and logistic management in Zambia. And the other one says, outline 3 reasons why supply chain management is important. Then state any 5 rights of logistics. With the aid of a diagram, explain the 5 major activities in the logistics cycle. Then the 4 activities at the heart of the logistics cycle. Now, looking at the question and the requirements to the question, we need to understand and answer it according to the nature of the question. So we'll not waste time, we'll directly go and try to extrapolate, rather explain the answers to this particular question. It will actually help you to understand and also to answer questions that pertains this nature under supply chain management. Let's begin. Define supply chain management. Define, meaning can you state the meaning of supply chain management? So what is it? You will understand that the answer is supply management refers to the planning and management of all activities involved in sourcing, procurement, and logistic management activities. It is called supply chain management. That is how we define. Okay, so we are saying supply chain management refers to the planning and management of all activities involved in sourcing, procurement, and logistic management activities. Full stop. That is the definition to supply chain management. The other question says, list 4 commodities that constitute the supply chain and logistic management in Zambia. 10%. How do we approach this particular question? So we need to list 4 commodities that constitute that supply chain and logistic management in Zambia. Answer number 1. It is essential drugs. Number 2, ARVs. Number 3, HIV test kits. Then number 4, laboratory supplies. Right? So the question was, list 4 commodities that constitute the supply chain and logistic management in Zambia. 1, essential drugs. 2, ARVs. 3, HIV test kits. And then 4, laboratory supplies. Those are the answers. So we carry on. The other question says outline 3 reasons why supply chain management is important. So we need to explain the 3 reasons why the supply chain management is important. So how are we going to explain this? Right? So I need you to follow me so closely here. We need to outline 3 reasons why supply chain management is important. So first and foremost, let's give the reasons. So reason number 1 is that it increases program impact. Number 2, enhances quality of care. Then number 3, improves cost efficiency and effectiveness. So these are the 3 reasons why supply chain management is important. Now, what do we mean by these reasons? So we said increases program impact. Now, under program impact, rather the increase program impact is that, this is actually achieved by providing a reliable supply of commodities, thereby making more people to use health services. So it's important in that way. So clients would actually feel more confident about the health program when they have a constant supply of what? Commodities. That is how it increases program impact. Excuse me. Now, the other reason we said was enhances quality of care. What do we mean? So quality of care is enhanced because well supplied health programs will actually provide a superior service, while poorly supplied cannot. So furthermore, well supplied health workers will be motivated to use their skills and expertise fully. All right, so that is how it enhances quality of care. Then the other reason we gave was it improves cost efficiency and effectiveness. How? Let me explain this. This is actually achieved by reducing losses due to overstocking, waste, expiry, damage, and pilferage, thereby protecting other program investments. Okay? So effectiveness relates to the outcomes, rather the results of a program, or we can say activity. Okay? So efficiency is often referred to as doing things right. Doing things right. Okay? That is not wasting resources. So basically, that is how we can answer and tackle this question. Okay, then the other question says, state any 5 rights of logistics. State any 5 rights of logistics. So what are they? Number 1, the right goods, or rather commodities. Number 2, in the right quantities. Number 3, in the right condition. Number 4, delivered to the right place. Okay, then number 5, at the right time. Then 7, for the right cost. Okay, so those are the 5 rights. We can even proceed to that number. Okay, so if a question comes, please remember the rights: the right goods, commodities, in the right quantities, in the right condition. Okay, delivered to the right place, at the right time, for the right cost. Those are the rights of logistics. Okay, now question D says, with aid of diagram, with the help of a diagram. In other words, explain the 5 major activities in the logistics cycle. Explain the 4 activities at the heart of the logistics cycle. So we need to be very careful with the way we tackle this question, because it really needs understanding. The way we approach it determines how many marks we can get. Okay, let's begin. So the first one, it was saying we explain 5 major activities in the logistics cycle. So here are the 5 major activities in the logistics cycle, and then we explain them. So number 1, I am answering B1, the 5 major activities in the logistics cycle. Number 1 activity is serving customers. Number 2, product selection. Number 3, quantification. Number 4, procurement. Then number 5, inventory management. Now, what do we mean by these activities? So let's try to give light and shed light. So we started with serving customers. That is one activity in the logistics cycle. So what do we mean by this? So actually we can just say goods or commodities are selected, procured, stored, or distributed to meet the customer needs. So each activity in the logistics cycle is aimed at ensuring that the customer receives the best commodity and service. That is serving customers. Then we go on to the other activity, which is the second one. We said product selection. Now, what do we mean by product selection? So this is done at national level to select the products needed to deliver quality health care, which in turn are delivered to health facilities. So relevant products must be therefore selected to meet the needs of the clients. Very paramount. The third activity in the logistics cycle is quantification. So quantification actually is just the process of estimating the quantity and the cost of each product required for each specific health program or service. That is what we mean by quantification. So after the products have been selected, the required quantity and the cost of each product must be determined, right? Correct quantification will prevent overstocking or stocks out, all right? So that is what we mean. And then the fourth activity in the logistics cycle, we said was procurement. Procurement. So what do we mean by procurement? So this refers to the action of obtaining required commodities either through buying or ordering from a central supply unit. So health systems, or rather programs, procure from international, regional, we can say, or either local sources of supply. It's imperative in that way. And then the last activity in the logistics cycle is the inventory management. So what do we mean? So this actually involves storage and distribution of procured and received items. Each commodity must be accounted for, stating its movement from one level to another until it reaches the customer. So those are the 5 major activities in the logistics cycle. 35 in you. There we go. The last question says, with the aid of the diagram, explain the 4 activities at the heart of the logistics cycle. Now, marrying the two, they need the diagram. Now, let me just show you the diagram. Here is the diagram. Okay, here is the diagram. This is the logistics cycle we are talking about. So, like we said, with the first one, we gave 5 reasons. So you're able to see serving customers, product selection, and quantification, okay, and procurement and inventory management. So all those are actually the major activities in the logistics cycle, and we have actually explained, so you can see from where we started, serving customers, then here we have product selection, then it goes on to quantification and procurement, we can say, then the inventory management or storage and distribution. These are the major activities. So it starts from here, coming there, then there, then there, finally, right? So now, looking at this diagram, which is actually helping us to understand how the chain works, let's go to the final question. It says, the 4 activities at the heart of the logistics cycle, at the heart of logistics cycle. What are these activities? Number 1, it is organization and staffing. Number 2 is budgeting. Number 3 is supervision. And number 4, it is monitoring and evaluation. These are the 4 activities at the heart of the logistics cycle. Now, let's try to shed light over this. Okay? Let's try to shed light over this. So you're able to see the activities at the heart of the logistics cycle here. Then around them we find the activities, the main activities of the chain supply, right? So let's shed light now over these particular activities. We started with the first one called organization and staffing, which is this one. What we mean? So actually it is well trained. Okay, well trained staff are needed to monitor stock levels, place orders, and provide products to clients for a logistics system to work well. That is what we mean by organization and staffing. All right, then we go to this called budgeting, which is the second activity at the heart of the logistics cycle. Budgeting. Now, allocation and management of funds directly affect all parts of the logistics cycle, including quantities of the products to be procured. So resources must actually be mobilized for procurement of the required commodities. That is what we mean by budgeting, right? So it is important that we follow up these principles. Then the third one, friends, says supervision. So staff who work within the logistics system must be supervised so that the work is done correctly. Routine and effective supervision of staff will help to prevent and resolve supply problems. Okay, and then we go to monitoring and evaluation. Now, what do we mean by this? So routine monitoring and periodic evaluation of the pipeline and logistic system activities will help in understanding how well the system is working and the areas that need improvement. So that is how we tackle this particular question. So remember, for easier understanding and the way you need to approach this kind of a question, first and foremost, look at the surrounding, meaning the main activities that takes place onto this particular cycle. Okay, service customers, product selection, and so on and so forth. And then rightly at the center, that is where we find the heart, right? The main activities of the heart of the cycle. Now, in an exam, sometimes this particular diagram, you may be required to draw it, like in this case, according to the question. Okay, it has required us to do what? Draw. So you need to know that it has two factors. One, activities around it, and the heart activities. Then you are done. Otherwise, thank you so much. This was Mr. Malambo. God bless you. And, follow us. Ask questions and contact us using our platforms. Thank you so much. All the best.